Social Work Committee, 17th of April. I'd just like to remind everyone the meeting will be recorded, and that recording subsequently will be available for public listening. Just as a housekeeping thing, the fire alarm may be tested during committee. It is just that it's a test. Apparently the engineers are working on the alarm system, so it's not a drill and will continue. Obviously, if there's smoke coming through the bottom of the door, we'll think it's something different. But we can take that as is just now, okay? Sorry? Pick up windy, aye, absolutely. Okay, right. Sederunt, apologies.
Thank you, Chair. We have 6 apologies this morning from Councillor Yen, Councillor McGregor, Councillor Mail, Councillor Nicholl, Councillor Stitt and Councillor Syme. Therefore, we begin the meeting with 13 members present.
Thank you. Have we any declarations of interest? No. Thank you very much. We move on to item 3. This is a carer's journey at the Carers Centre, a presentation by Claudine Brindle. I'd like to welcome Claudine here today. I've actually seen this presentation at a joint event and felt it would be interesting members and help you understand the new processes that are kicking in just now. Claudine, over to you.
That's it. That better? That's great. Thank you. Thank you to Andy for inviting me along to speak this morning. My name's Claudine Brindle. I'm the manager of the Dumfries and Galloway Carers Centre, and just to start off with eliminating any confusion, you may well have heard about us in the past under the name of the Princess Royal Trust for Carers, and we are still the same organisation. We've just branded locally under the Dumfries and Galloway Carers Centre name over the last year to 18 months. So I've been asked to come along today to actually give you an insight into some of the services that the Carers Centre actually offers carers across Dumfries and Galloway, and how we can actually help carers and their families and what difference we can make. And hopefully today I'll show you some of the outcomes and the real tangible outcomes that our service can offer to carers. First of all though, I wanted to start off by just clarifying the definition of who is a carer. There are a lot of confusion around the term carer. It gets confused with paid carers who come in and offer support that are paid through a home care agency. But just to clarify, our service provides support to people that care for a family member or a friend who suffers from an illness or disability. And that can be any illness or disability, and it can be any age and anywhere across the region. Just some background. Caring is on the increase. You hear about it in lots of different papers that come to Social Work Committee and to council members across the board. It's estimated that there are over 7 million carers in the UK, and that's around 1 in 10 of the population. However, they do say that that's actually an underestimation because people sometimes don't recognise themselves as carers, and it's these people that we do really need to try and target to ensure that they can access services and support when they need them. A bit of background about our organisation. Our organisation has been around for 17 and a half years in Dumfries and Galloway now. We started off relatively small. We're Dumfries and Galloway's only generic region-wide carers organisation, and that just means that basically we offer all carers support no matter what the illness or disability that they're looking after. We're primarily funded through the Dumfries and Galloway Council. We receive some money from the NHS, and then it's my job to bring in money to the region from lots of different national organisations that do provide funding to carers services across Scotland. And we do that as well, and that's a big part of our fundraising, and we do local fundraising as well. So the way our service is funded is built up from many different funding streams, but primarily the biggest funder is the council itself. We're part of a national network of services under the Carers Trust. That's our national umbrella organisation, but we're a locally managed organisation so that we can respond to Dumfries and Galloway's needs in the way that it needs to be. and we have a local management board of people that have an interest in carers or who are carers themselves, and they oversee the organisation. So, as I said, what I wanted to do today was to actually give you a picture of a journey of a carer when they come into our organisation, and to give you an actual example of how someone can benefit. So we're going to talk today about a Mrs. Bradley who, and obviously names have been changed, but we're going to talk about Mrs. Bradley today who identified herself, she referred herself to the organisation by returning what we have across the region in GP surgeries, in libraries, in hospitals. It's a self-identification questionnaire that people fill in, and they simply send that back free post, and it comes into our organisation. And what we do find is carers still find it difficult to pick the phone up to ask for help. They won't necessarily see our leaflet, or if somebody says to them, why don't you contact the carer centre, they still find it difficult to actually pick the phone up and ask for a service from us. But they're more than willing to actually fill a form in and post that back, and then it's us that make that first point of call. And carers tell us time and time again that that's the way they feel most comfortable with. It means then that we will then phone the carer and arrange to meet with them at a location that's suitable for them. As I said, and I'm aware obviously there's people across the region here, we have a carer centre in Dumfries which is on the White Sands and Ness Street above DGHP and alongside that. But we also do have a base in Castle Douglas and a base in Newton Stewart, and we have an Annandale and Eskdale support worker that covers the east of the region who is based within the Dumfries office as well. So we do have good representation across Dumfries and Galloway. However, Mrs. Bradley did return the leaflet to us, and she was from Dumfries. She was allocated a support worker who then contacted her and invited her in to discuss her situation further. It became apparent that Mrs. Bradley was 48 and cares for a dad who's in his 70s, and he'd suffered a stroke around 6 months ago and had been discharged from hospital with a care package and was at home. So this lady actually cared for her dad who lived on the other side of Dumfries. She needed to visit daily at that point and was helping with meal preparation, and so the paid carers actually visited 3 times a day. They were looking at the meal preparation and personal hygiene, but there was the whole keeping the house, doing the budgeting, doing the shopping that Mrs. Bradley felt that she needed to visit and help her dad with at this point. There were some issues around the provision of service through the care agency that Mrs. Bradley and her father was saying that they were unhappy with at that point. She's a single parent and works 30 hours a week, so is combining her paid employment with her role as a carer, and was considering reducing her hours, or actually thinking about that she may have to give this job up, and she needed to have some information around that. She has a daughter of 17 and a son of 14. And she's recently seen a deterioration in her dad and was worried about what the future holds. And not necessarily a physical deterioration in her dad, because obviously services would come in then, but around his well-being, and then obviously that was having a knock-on effect to her and was affecting her sleep patterns and things like that. When we were talking with her, it actually came out that she had a son, a 14-year-old son, who was also on the autistic spectrum. He attended mainstream school with extra support, but he also had a visual impairment. Her 17-year-old daughter at this time was also applying to go to university out with the region, and that was hopefully the plan for her future. She'd heard a little bit about self-directed support, personalisation at the point when she came into us, and she had a feeling that she would maybe need to know more about this and would like to find out. As I said, she talked about not being able to sleep well and was particularly worried about supporting her daughter to go away to university, but dealing with the anxiety and the conflict that brought up in her, because really her daughter helped out a lot with looking after the 14-year-old son, being there when she had to nip out to be with her dad, and her whole support network would be changed completely once her daughter went away to university. She at this point had quarriers in twice a week, 4 hours in total, to take the son out to look at his outcomes. So what would we have done in that situation? What we do is a worker would meet with the person one-to-one, gather all this information, and actually formulate some kind of action plan in a way to help Mrs. Bradley look at what we can immediately help with and what the initial issues are, but then what we can hopefully look long-term, how we would help her shape her future and her family's future. So obviously the things that came out from that straight away were looking at our options around employment. It's obviously a big decision for someone to reduce their hours or to actually give up employment. It has huge implications for the future around pension, around the income into the household. Obviously with a daughter hoping to go away, it's an expensive time. So she really needed to look at what options were available to her around that. And obviously then she would need to be referred for financial advice, and this is something we would look at. The issues with the care agency was something that was a key problem at that point, and that would need addressing. We also looked at what other services were involved, and if there was things that we thought were missing that the family could benefit from, we would look to refer the family on at that point. At the outset, the longer term action would be to look at what kind of package could be set up through personalisation, if that was possible, and if it was something that they were interested in. Really looking at Mrs. Bradley's health and well-being. It's well recognised nationally and documented regularly, the effect that caring has on the carer's health and well-being, and it's something that carers still don't prioritise because they get so wrapped up in looking after the person that they're caring for, they don't prioritise their own health and well-being. It's something we see time and time again. We would also look at support for the daughter around the transition to university, and also about looking at all the other different carer centre services that she could access if she chose to on an ongoing basis. So, one-to-one support was provided intensively at the beginning. This could be as little or as much as the carer needs. We looked at the employment issues with this person. We looked at all the different options, encouraged her to speak to her employer to look at whether they could offer any flexibility around the hours, or whether it was a possible option to reduce hours, or how she was going to maintain the 30 hours a week. We didn't actually have to assist the carer to speak to the employer in this situation. She felt empowered to do that herself, but if that was the case that we needed to get involved in that, that's something that a worker would go along and support a carer to do. We referred to the Fiat team, which is the council's finance team. We have a strong partnership with this team. They offer clinics within our carers centre and within Castle Douglas, and we have straight referrals into the worker in Wigtonshire and in Annandale and Eskdale. And the reason we have clinics was the waiting list was really quite large in Dumfries and in the Stewartry just over a year ago, and we were trying to look at ways that we could get carers quicker access into the service. And by them providing a clinic every 3 weeks in Dumfries and every 4 weeks in the Stewartry, we're able to refer carers straight into that and get them an immediate appointment. So that's been a really good partnership that we've been able to set up. And also it means that my staff have now got access to a Fiat worker to get in contact with them whenever they want to find out any information around benefits and get those checked. So at this point, all the benefits were looked at around the dad's benefits and what implications it would be if Mrs. Bradley did decide to give up work. Her benefits options were looked at as well, so that she could make a fully informed choice. My worker at that point contacted the family's social worker and discussed the issues around the care agency, and it was a typical example of where there was a lot of different paid carers coming into the house, and Mrs. Bradley's dad never knew which paid carer was going to be arriving, and there was over a week there could be sort of 10-15 different staff showing up, and he really felt that he would like a smaller team so that they got to know him and his needs better, and he got to know them. And a lot of people don't want to make that step of actually speaking to the care agency because they don't feel that they're in a position to do that. And our role is about saying to them, you know, you are directly a customer of this service, and if you were a customer of in Morrison's or in Tesco and you were unhappy with the service, you would go and speak to them and try and sort it out. And it's about trying to get people to look at things slightly differently and realise that they can just open that communication up with the care agency, and often that's all it is. And we discussed it with the social worker, and then Mrs. Bradley did speak to the care agency with her father and they looked at setting up a much simpler package, as and when they could do. Obviously, sometimes there are issues where if people are off sick and things like that, but all that was explained to them, and things started to even out. We looked at then referring Mrs. Bradley's dad to the food train, which obviously is a service locally that would do the shopping for him on a weekly basis. This then removed that from Mrs. Bradley, feeling that she had to do that every week and make sure that the shopping was there. Also, the dad was much more in control of that because he would make his own shopping list up, so it was making him feel a lot better about that task and that he wasn't being a burden to his daughter in that way. We also, at that point, gave them information about chest, heart and stroke, and he did go on to access some services through that organisation locally too. Range of services available through the Carers Centre. A lot of that's focused on the carer's health and well-being, and we also looked at giving her information about supporting her in her role as carer for her son as well, and that was about accessing services that are also available through the third sector locally. Just to give you a picture 6 months on, that one-to-one initially at the beginning would obviously decrease over time depending on what Mrs. Bradley wanted from the service, but she could drop in at any point, she can phone up. We would always check in to see how people are getting on, and 6 months on they reported the improved relationship with the care agency, food train now in place. Dad attends group and trips through chest, heart and stroke or through the befriending at the food train. Mrs. Bradley was also referred to the Keep Well team through our service. This is again is a partnership that we have with the NHS Keep Well team through Carol Stewart's team up there. And this is a really positive addition to our service and a development that is really key within the NHS at the moment. And it offers carers a physical health check around the blood pressure, diabetes check, weight, all the usual kind of MOT stuff you would get done at a clinic at your GP. But it also offers them a wellbeing check where they fill in a wellbeing questionnaire, and it looks at the anxiety levels, the stress levels that carers are suffering, and looks at the whole lifestyle around sleep, eating, drinking, and what that team has reported in, and they've been really surprised at the high levels of anxiety that carers have scored through these checks, and also the reliance on alcohol that a lot of carers, they've found that carers have their very high level on alcohol dependence to actually get through the day and through the week. And it's really surprised them, and they've been able to go on and do a lot of work around addressing these issues. What happens on the back of the Keep Well check is a carer is then referred to health coaching, and it's a professional coach that they would then have up to 6 sessions with. And it's a form of counselling, and the difference that we've seen this make to carers' lives has been quite immense, really, and around lifestyle changes and reductions in the anxiety and real differences in cutting down on alcohol, cutting down smoking, overeating. So all the things that would be seen as a preventative measure for the future, because obviously if the carer becomes ill, who's then going to go on and look after the cared for? Mrs. Bradley attended an assertiveness course that was offered through our centre. As part of our health and wellbeing programme, we offer lots of different wellbeing courses. There's your basics around the first aid, moving and handling, but we also go on to look at personal development courses for carers, and assertiveness would come under that scheme. We also deliver mindfulness courses at the moment through the Health Improvement Partnership, and Mrs. Bradley went on to do that. And again, we've had about 20 carers go through the mindfulness course over the last year, and we're just about to start a new course, and the benefits again that have been reported back and the outcomes have been really quite astounding. Remember we talked about the 17-year-old daughter in this case, and she was looking to access university. We were able to provide a service to her through our Young Carers project at that time, and she was able to speak one-to-one to a worker to discuss her concerns about going away. It's a lot of pressure on a youngster at that age when they're looking to move away from home, but also know that their parents are carrying a huge caring role and they will be walking away and leaving them to get on with that. And a lot of young carers do actually go away to university, but statistically they don't finish the first year, they return home because of the added pressure that they're experiencing. And it is something that hopefully we can try and look to address with them. We have just recently developed a young adult carers service. That's our new project this year, which has been funded through carers strategy money for the next 2 years locally. And that's about supporting young people between the age of 18 and 29. So if this carer now came into us, we would probably refer, although she's just 17, we would look at each individual situation, and she would be offered support through Rosemary, our young adult carers worker at this time, who would look at all her options. We can help with funding. In this particular case, we applied for money for driving lessons for the young person, and also made financial applications to Hollywood Trust for books and resources to assist her when she moved to university. We provided a personalisation training course which my staff deliver to carers to look at try and develop people's confidence around building up a personalisation plan. You'll all be aware of the Act and its implementation and what's been happening locally. And we've really sort of embraced the idea that personalisation can make huge differences to people and the outcomes can be quite significant. So the course looks at trying to get carers to the stage of presenting a plan to social work with hopefully getting their own budget in the future. In this case, we actually funded a short breaks trip for the mum and daughter to go away while the son was on a school trip. Really provided them with quality time together. We run a short breaks fund which we receive funding from Shared Care Scotland nationally, and this is the government's way at looking at how to provide short breaks to carers. We've been really well supported again through the Council and the Health Board locally for the Short Breaks Fund, and they've provided additional funding. We have a monthly panel where carers apply, and the panel sits every 4 weeks, and we decide whether to award funding or not for a short break. And in this case, the short break was funded for them to go away. The short break doesn't need to be a holiday away. It can be some kind of outcome that could be a gym pass for a carer, a bike, so that if that's their way of getting a short break away from the caring role, it can be really something that's thought outside the box. And there'll be information in the handouts in the pack I've got and the presentation later on about the short breaks thing specifically. So again, we looked at referring the carer to the GP to make sure that the GP knew that Mrs. Bradley had a caring role, and also her daughter did as well. And there was what's called a KISS summary, which is making sure that out of hours and the emergency services would know that they had a caring role as well if they ever ended up at A&E. And this is something new that's being brought in. This particular carer was registered with Gilbray practice, and Gilbray have really done a lot of work over the last 12-18 months on supporting carers in liaison with ourselves. And overall, the one-to-one support will continue for this family as and when they need it, and they will be on our email and mailing list, so they will get our information through on a regular basis. And at that point, really, it's about us keeping in contact with the carer, but also them keeping in contact with us and coming in and picking the phone up if they've got a problem. But they really are on our mailing list for the foreseeable future, and we've been around 17 years, and I've been there 17 years, and there's people that came in the first few weeks of our service opening that we are still supporting as carers today, because obviously caring doesn't necessarily end. It can go on for many, many years. So I've got a lot more information that I could talk about, but obviously I know time's precious for you this morning, and I am prepared to sort of take questions. But I mean, basically they're the outcomes that this particular family was supported around. And hopefully, we can't be everything to every carer that comes in, but carers will hopefully, when they contact our service, see at least one of these outcomes improve for them, if not more, and will continue to have access to that service in the future. Okay, thank you very much.
Thanks. Thanks, Claudine. Has any member got any questions for Claudine? Jane?
Thank you very much, Claudine. That was really extremely comprehensive and I must admit very interesting. I was quite intrigued by the mindfulness matter that you mentioned to us. Could you possibly expand a little on that?
Yeah, do you know much about mindfulness?
No, nothing at all.
It's kind of a buzz course at the moment that's really increased in popularity over the last 2 years. And we were approached by the Health and Wellbeing team through the NHS Public Health Department, who 2 of their members of staff had been trained to deliver mindfulness and wanted to be able to offer that locally. And were keen to offer it to carers because they could see that, they hoped that they could see how it could improve carers' outlook on life. And mindfulness, it's based on, and I don't want to, we don't sell it in this way, but it is based on the Buddhist principles and historically set in that way, and it comes with manuals and there's much been written about it, but it's very much about concentrating on the here and now, not worrying about what happened in the past, trying not to worry about what's going to happen in the future, but living your life in the here and now. And you can really see how when someone's a carer and struggling with everything and trying to juggle all these balls and keep everything up in the air, that for them to try and get the worry away from them and concentrate on what's going on in the here and now could be so useful to them. And it's about teaching them how to practice that on a regular basis, as well as attending. It's an 8-week course and it's 2-hour slots. And what we've found is the carers that have gone through that, a number of them developed friendships and a peer support group within that training, and they now meet monthly within our centre. They've called themselves Minders, and it's just basically their own peer support group. They come in monthly and they can drop in and out of it. If they can't make it, it doesn't matter. And they then practice what they learnt on the course, or discuss how it's benefited them, or discuss some of the stresses that they've been under over the last month. And it's really, really gone on from that first group that went through it and the second group that's just finished. They've now, some of those members have joined that group as well. So the peer support that's come from that has been really valuable. And I think, yeah, we can provide workers to do pieces of work with them like I've shown, but that introduction to other people and the peer support, and then they meet for lunch and the friends on Facebook and, all that kind of thing that goes on out with, is really crucial to a carer to prevent them becoming isolated.
Thanks. Ian?
Thanks, Chairman. I think it was a really good presentation as well, and well detailed. I would agree with Councillor Maitland in that. I suppose the one thing, because it was so comprehensive, is there any way of quantifying, because every annually we're always looking at budget costs, again, how we fund things and different things as we go on. Any way of quantifying the financial impact for the council towards that, and potential savings is what I'm thinking, and no the detriment side, because we're investing in the organisation that you work for, and obviously we see the benefits and the returns here, but just I wonder if you've got any figures in regards to the financial benefit as well, on top of all these other things.
I haven't offhand. It is something that our national organisation does look into, and there has been reports done about the full cost recovery of a service and the impact it has. And I can get that information and feed it into Andy, and he can circulate that after. But it is about that. It's very hard to quantify the preventative stuff, and you'll come up against this all the time. And I think nationally, as one of my first slides said, the carers are saving the government something like £6 billion a year. It's a huge amount of money, and it's about trying to provide that support to them at an earliest possible point, and getting carers keyed into services to try and stop them reaching crisis, because it's then that it costs you money. But to actually quantify that, it is really difficult.
It'd be good, Chairman, if we could get some feedback from that if possible. Thanks.
Yeah, absolutely. Jim?
Thanks. This is a standard question. Your case study was about somebody who made a self-referral through the GP's surgery.
Yes.
Are there many other mechanisms that you use to reach out to these people in the first instance? And are you comfortable that that's functioning adequately right across the region, that everybody has the same opportunity to access your services? Right,
okay. We get referrals to the service from many different sources, across social work, across health professionals. We still get about 50% of the referrals are people making a self-referral, or they've heard about us through another carer or organisation. we've seen a lot of increase in the referrals from social work department, particularly to the Young Carers Project. They're a really good referrer to that service. And we do have a hospital project where we have carer support workers based at the infirmary, and they're keyed into some of the wards and the social work team up there. So we do get referrals right across the range, through schools, through education, preschool home visitors. You never know where someone's going to come in from. There's always more people that could be referring to us. I could go out and do these presentations 7 days a week to groups, to professionals, to say, refer in, try and get people on board. It's a fine line between how much capacity you've got to provide an ongoing quality service to how many times you can keep. I've always said we could employ a full-time marketing officer, but as long as we had the service to back that up when all the carers came in the door. It's estimated there's around 20,000 carers across the region, and really any service like ours are probably only scratching the surface, and it is about trying to get there and target the hidden carers. A recent development through the carer strategy, through Dumfries and Galloway Multicultural Association, they've just employed a carer support worker, and it was the decision was made to actually house the carer support worker within the Multicultural Association on the back of a piece of research that was done last year, where a lot of their members said they would much rather access carer support through that service rather than having to walk in a new organisation like ourselves or through Alzheimer's Scotland or Support in Mind. So what we've done is we've worked with them to recruit the person, and there'll be no replication of services. That worker will encourage the carer to access services through ourselves and make that journey easier. So it's just another way of coming into services. So that'll be really interesting to actually feedback the results of that project. Literally, the interviews were last week, so they have recruited, and we will work alongside them to try and target. Also, we're also doing the LGBT charter mark to try and make our service more, our service is accessible, but to try and make it open to that community as well, and that we offer a support to them, and are aware of the difficulties that they come up against as well as caring. So.
Okay, Ian again.
Actually, just because of the information that you supplied there, because you said, I think it was roughly, was it 1 in 10 people are carers, and you're saying 20,000, with the population of Dumfries and Galloway, that brings it to about 1 in 7, I think it is.
Yeah.
If you take the under-16s out of that, it's probably 1 in 5. So it seems really high. How does that compare against the rest of Scotland?
It's pretty standard. I feel more comfortable with 1 in 6. Census figures came back 1 in 10, but census figures are only as good as whether people have actually identified themselves as a carer when they're filling the form in. So I would always go with 1 in 6, and I think, again, yeah, you've got your under-16s across the region, and they say 20,000, and probably about 13,000, 14,000 of those carers will have what's called heavy-end caring duties, but it's still a significant number. Our inquiries over the 17 years, we're now up to about 8,000, but those come and go, and people will have been with us for a long time, or their caring role will have actually ended. So there's always new carers coming on board, because you never know when you're going to become one, and it can affect anybody at any time. And may well affect some people in the room here today. So.
Okay, thanks. Wally, one last one, and then I'm going to move on, because we can contact Claudine through our work. Wally, last question, yeah?
Yeah, Claudine, I'm looking at your outcomes there, improved health and well-being, improved access to quality services, anyone. And if I take the one improved health and well-being to the 20,000 and more, I'm sure, of carers out there, what are your measurements against those in terms of how you are improving the outcome for the carers? i.e., for instance, I think it's running at something like, and you said earlier in your presentation, that many of them didn't identify or recognise their own needs. Within that improved health and well-being, where I think that in terms of carers assessment is running at something like 13 to 14% of carer assessment. What's your measurement against how well you're improving
within your organisation to say, well, things are improving for under the outcomes? And have you got anything that you can produce?
Obviously, we produce annual reports. We look at figures of people accessing our service. But what we do ask carers is around the difference that our service makes to them, and we do that annually, and we have a measurement tool that comes back in that shows that there has been a significant difference around lots of different aspects of their life, around health and well-being, around isolation, and we will continue to do that and can produce figures to do that. One of the things that we did do last year, and if I just flick on to for the first time, we asked carers if they could describe in one word what the Carers Centre actually means to you. And we produced a picture as a result of that from all the words that came back. And I didn't just ignore the bad ones because there really wasn't any. It was these words that come back, and the case study examples like I've given today, where we can actually show the difference that we make to an individual life. And these case study examples are being used much more now within research and within feeding back. And I do think they provide a useful tool to actually say, well, to actually try and quantify some of the qualitative stuff and the impact that we're having on people's health and well-being. And just from the feedback that we get and the people that continue to use our service, I think that's a huge reflection on the people that return to use us year after year. We can average about 500 new people a year that we identify, but we're having 500-600 other people reusing the service year on, year out. And that, to me, says that we're doing something right.
Okay, thank you. Claudine, thanks very much. I believe you've got packs for the members.
Yep, I can leave those there.
And we can get them distributed for you. Can we get an electronic copy of your presentation? Because I understand you've got a lot more than you actually gave us today on that presentation. And we can circulate that around the committee as well. I'm actually pleased to get a carer's insight, which is vitally important to us. And I'm also pleased that in the case study you gave us, and I appreciate that they're not all like that, there was some really close working between the council, the NHS, third sector, and other outside government agencies. So it's like an example how integration and early intervention actually can work. So thanks very much for your time.
No, thank you for
okay.
inviting me along
Thank
today.
You. Right. Thanks very much.
Thanks.
Okay. Yeah, I'll just give Claudine time to gather our stuff. Okay, we're moving on to item 4, the external scrutiny of social work services. Heather, Collington, I believe you're taking us through this. Have you anything to add, or can we go straight to questions?
I'm happy for you to go straight to questions on this.
Okay, any questions? Ian?
I've picked up on 2 or 3 across, but I'll just want to start off with one of the themes that came through was infection control, and it seemed to be in 2 or 3 of the different organisations. Is that a problem throughout, Heather, just as a starter for 10? There's different records saying it's picked up in 2 or 3 different bits. A better level of cleanliness, I think. When I was reading through it, that certainly as I picked up, there's recommendations on how to improve that as plans in place. But if you pick up that in the first, and I'll read through my other questions. Thanks.
Heather?
Okay, I think there's a huge emphasis, certainly from the care inspector at the minute, around that quality of environment, quality indicator. So you would look for that to sort of like be one of the key things people would look at. We would want to always make sure that if there was any issue at any level raised about sort of like the environment in terms of cleanliness or hygiene, that was picked up immediately. And I think certainly from the ARC point of view, they're very good at doing that and making sure that that's followed through. So those are sort of, when that would come through as a recommendation, then that's something they would start to work on immediately, really. And even by the time you had the action plan ready, it should be sort of like on its way to being sorted. So it's a really important one. And in a sense, you would look to the care inspector to say, give us the reassurance around these sort of issues about quality of environment. And therefore, if there were any gaps at all, we would move really quickly to shift that. And I think if you look at the gradings, you know, it isn't as serious an issue in terms of the gradings that are coming through, you know, at 4s and 5s. If it was a major issue coming, it would probably be graded much lower than that, really. So it's something that, yes, absolutely, there's probably room for improvement, because that's what care inspectors are saying, but something that would move quickly and they would sort out.
Okay, Ian. You want back in, yeah?
I'll come in if there's nobody else wanting in. I've got more questions if that's okay. I mean, I certainly picked up in the... That's how I read it as well, Heather. So I thought it was, because it was in about the 4 or 5s or the 4 mark anyways, I thought it wasn't severely important, but obviously they picked up on it still. Seeing 4.2.3, which is page 6 of the report, there's a box with figures in it, the quality indicators in as a paragraph. See the last sentence of that paragraph? It says, the service was still addressing some of the issues arising from this unsettled period, including the need to maintain the condition of the environment and to strengthen the relationships within the staff team. When it comes to that, just because I've not read everything and I'm just picking up this, what does that last point mean in particular in regards to strengthening the relationships within the staff team?
Okay, this came from the previous report that the Care Inspectorate had done. So this is a direct lift from their comments on this most recent report. And so it's that bit about being really clear about that consistency between recommendations coming through from one report to another. And if you remember, in terms of Cairnryan House, it's fairly new in terms of getting settled, a new staff team, etc. So at that early stage, the previous report, they would have highlighted that bit about this is a staff team beginning to settle, find their place, and they were commenting saying, yes, we've made some progress on that, but obviously there's maybe some work still to be done. But I would suggest that given the age of the service, that isn't necessarily unsurprising. And again, we would look to the Care Inspector to make, you know, they've made some really good comments in terms of how they've moved on around, certainly the use of outcomes-based work with children, and that's been excellent. So that bit about making sure we consolidate that bit around a staff team who've come new together to make sure that they're, you know, addressing the outcomes for children is really important.
Can I have a secondary to that one, please, Chairman? So you're saying it was a new team because of my lack of knowledge only, Heather, I'm asking this. It was a new play set and a new facility, Cairnryan, but was it a new team as well, and is that what you're saying?
It will have been in part new. It won't necessarily all have been new because it will have come from the previous service. But again, you know, you were looking at a team that, even where there were members of staff who were there previously, would have been coming into a new environment with a new group of children, in a sense around how you move some children from the old environment, maybe bring other children in, about just finding your feet and your routines around working in a new environment would have been what was key to this, really, about that bit about you would have looked to sort of run your service in a more efficient, effective way with the environment you were given. And I think that's come through with the comments they've made about the really good work that team have done about outcomes for children. I think that comes through really strongly. And that's a really important bit of the practice with children that we would want to encourage.
Jane and then Roberta.
I'm looking at the numbers and the sort of grades and measurements, and in fact, actually, they are perfectly satisfactory. The lowest is good. But I would like to pick out the Castle Douglas community support matter, and I'm interested in recommendation 5, which is about the management need to ensure that all staff are aware of the arrangements in place to make sure that care records and other key working tasks are kept up to date. Now, I would have thought that's absolutely critical. That's kind of fundamental to what we do. So I'm quite intrigued, actually, at that you can say that it's good, and yet that's something that seems to me to be so fundamental about keeping care records up to date. That I'm quite interested in how you could actually reconcile those two things. Please.
I think that's a really important issue. You know, the bit about acknowledging the importance of having records, keeping them up to date. Again, yes, if you look at where the sort of the grading came out, then quite clearly the issues were not, you know, hugely serious to bring the grading down. So it would have been that the Care Inspectorate would have identified some gaps or some areas for improvement, but they wouldn't have been saying overall that we weren't keeping records in a way that you would expect. It would have been about saying, this is what you're doing, this is the level you're doing in it, but there are clearly some room for improvement, and gaps there that you'd want to address. And again, we would say really clearly that bit about continuous improvement, wanting to move that grading up, you would absolutely want to go in and you'd want to do that, really.
Okay, thanks. Roberta?
Thank you, Chair. I'm back to Cairnryan House, quality of care and support, recommendation 1. Very pleased to see that the reference has been removed, re the emergency room, which is referred to as the dark room, I happen to know. And recommendation 2, are we staffed sufficiently to ensure that the children that live in Cairnryan House get adequate possible supervision when they go out? They have to, because of the situation of Cairnryan, it's stuck between 2 ports. It is a quite dangerous situation at times when the ferry's on, of lorries thundering through, sometimes in both directions. So it is difficult for children to go out in that area. And it certainly, is there enough staff to ensure that they can go to the leisure centre in Stranraer, for instance? Because this is a care home that opened in an area where there is absolutely nothing.
And there's some operational detail there which I may not be able to answer because I don't know the detail of in terms of the exact ratio around. However, what I would imagine in terms of certainly this report, in terms of what the recommendations are, there's no indication there at all to suggest that those ratios are not appropriate. And certainly for each child, they would be looking at a care plan that would be about how would they be supported in the community. And I think the other thing we need to remember as well is that, you know, for some of these children, we're talking of teenage children, so some of the work will be about supporting their independence and helping them to develop in terms of going out alone. So even though a care plan may include some time out, it may not require a staff member to go with them, and that might be part of a clear, positive plan around how you'd support those children through, and therefore you would look for younger children around how you would do that. But that hasn't come out at all in terms of a concern that the care inspectorate were expressing.
Okay, but do you want to come back on that? Yeah.
So when young people go out, there's a risk assessed sort of plan that they can perhaps go to the leisure centre, is that right?
Yes, there'd always be a risk assessment in terms of the child's plan, in terms of the plan overall, any risks in terms of the child themselves and any other risks there might be around. And you would look particularly at any particular activities that needed to be risk assessed. And that would be all part of that planning tool that you would have around how you made sure the plan was appropriate for that child's needs. And that would be done within that context of clear eye on what the risks might be and how you would mitigate those risks.
Chair, could I come back in just very briefly? Well, I was extremely disappointed last year because there was a sailor, a very experienced sailor, who offered to take children out in a sailing boat or in a speedboat. And the risk assessments took over a year and the children were denied the opportunity to actually get out and enjoy themselves.
That's actually an operational issue, I would suggest, Roberta, and if you can take up with the team manager. This is just with respect, this is an agenda item on the care inspectorate report, not the individual practice within.
I realise that, yeah. But it has referred to the risk assessments being a suitableness, and I think it was an appropriate place to bring it in, that the risk assessments were not done in this case. Thank you.
Okay, your point's made, thanks. Willie? Same issue, right? Sorry.
Yes,
okay,
I just want to draw the committee's attention to recommendation 2 there, which is quite clearly that the staff should be trained whilst avoiding risk-averse practices. I'm absolutely with Councillor Tuckfield in this, that I think it's terribly important to take advantage of opportunities and explain to staff that there are opportunities to be taken. And avoiding the risk-averse practices that I suspect probably we've got to take a hand in. We've got to accept responsibility for clamping down on people who do take sensible, assessed risks with respect to activities which young children do. So, I mean, it's there, and I'm absolutely with Councillor Tuckfield on that one. But I'm glad to see that the recommendation is there.
Actually, I mean, both your comments are well made, and I'm looking at Sean here that we can actually take that forward as an action out with committee. Yeah, Willie?
Yeah, Chair, it's on the same one, following on from what Roberta was saying, and to indeed what Jane is, in terms of recommendation 2 to recommendation number or recommendation 4. And in recommendation 2, it refers to updating, taking account of Scottish Government's Go Outdoors guidance, and then you relate that to quality of staffing. Recommendation 4, where it refers to in a way which can be responsive to the individual need and circumstances, while recognising the importance of consistent routines and boundaries. And I just wonder, Chair, whether indeed, and we all know that we did not entirely cover ourselves in glory in terms of the community consultation, the fact as to where the Cairnryan House was located, to what Roberta has referred to as between two busy ports, and whether the kids in, or the young people in Cairnryan House are actually getting outdoors because of the location, and whether there's something underlying in this report that we are not seeing in terms of the boundaries set, and whether they can get access to what Roberta said in terms of a leisure centre, which is a 12-mile round trip for these youngsters, and what access there is to some of the wider services in Stranraer under the government's Go Outdoors guidance, or whether it's just, they can walk the hills. I just wonder if there's something underlying in this report in terms of what we should be looking at in terms of the Cairnryan House location.
I mean, can you comment on that, Heather? It's an operational issue, but are you able to comment?
I can't comment on the operational aspect of it, but I mean, I think what's really important in this is to note the progress being made here in both these recommendations, and certainly in number 4, the fact we've got an in-service day organised for June, which is looking about staff development, and if you link that in terms of what you're looking at around greater use of the guidance that's been given, there's an opportunity there for that to sort of take greater note of those issues that have been raised by councillors in terms of whether or not we've got the balance right, because it isn't. We need to develop the risk averse. We need to move that risk averse to much more risk enabling, but that doesn't mean that we then move to a completely risk enabled service. There will always be times when it is not appropriate for young people to be involved in a risky activity, and the bit is about making sure that our clarity about what those activities are and the robustness of our risk assessments enables us to be really clear then about why those decisions are made. So we can certainly feed back in terms of whether or not that staff development day, which is already organised, can begin to unpick and look at some of those issues. That would feel very appropriate given your comments.
Okay, well, is it the same issue, Willie, yeah?
Yeah, Chair, and grateful for the explanation given by Heather. Whether it's an operational issue or a strategic issue, I think it's something for this committee to consider when we look at the recommendations 2, 3 and indeed 4, because what it refers to, if we look at 3, in response to what Heather just said, a new report under the progress, a new reporting system has been devised and all walls have been repaired week commencing 21st of March. I can well understand people's frustration, young people's frustration, and yet, I don't understand from what has been referred to as this being a new building, and here we've got a system has been devised and all walls have been repaired week commencing 21st of March. I'm not quite sure what that actually means, but then I go further and see, as Heather has just referred to, there is an organised day in June for both residential services, and up above it talks about boundaries. And I just wonder if perhaps there is a degree of frustration in terms of the young people at Cairnryan, in Cairnryan House, as to its location, and whether that's what's the underlying feature here in Cairnryan House, and whether that could be perhaps further explored as it refers to in the explore areas of tension, whether indeed this is required.
Okay, well,
I seek advice on that one, Chair.
I'm going to ask Sean to actually comment on the damage, I think, and the repairs that were required. Sean?
Thank you, Chair. Can't say I'm actually cited on what the damage was in the building, Councillor Scobie, but I think it's very important that when we are putting children into a residential home, that we try and make it as close to a normal house, a normal home as possible for them. I think people have got to be realistic here. These are some of our most vulnerable children, and one of the things that we have got to work with them is their underlying aggression, and sometimes children may take that out on the building itself, and it's important that we go in quickly and get those buildings repaired. I have heard absolutely no feedback from staff or children within Conran House to say that these children are not appropriately placed and that there is not a good family atmosphere around the home. Basically, that's all I can say, but it might be that this, we look at how this committee can be more focused and given more information about the life of a child in a residential unit, similar to what Claudine done today with the Young Carers movement. So I hope that covers that, Councillor Scobie.
Thanks. I'm going to let Roberta in. She's been very patient sitting there because for a wee while now.
Just my final comment on Kane Ryan House.
No, it's okay. You're fine.
Is that I believe the staff do a wonderful job under very difficult circumstances sometimes. So it's not criticism at all of the staff or the fabric of the building or anything else. Thank you.
Thanks very much, Roberta. And you and I remember it was actually in pristine condition, and that was only about a year and a half ago. So whatever the reason for the repairs needing done, it must be something, obviously, that we don't actually know exactly why, and I'm not prepared to guess, I think is the answer there. I've got Ian and then Willie.
Thanks, Chairman. Thanks for letting me back in. My next question is on page 9. It's recommendation 3. It's regards to the Rowan's Respite Unit. That it says the provider should examine the transparency with which it makes decisions regarding allocations of respite stays and should produce information on how it makes its decisions in a format that service users and families can access information and challenge decisions if appropriate. It goes on to say the progress is in place and the next respite allocation should go forward in June. What's actually been done about that? It doesn't explain what's happened, what the difference is, what the actual progress is.
Yeah.
Yes, I understand in talking to the service about this recommendation that they have drawn up a new way of allocating that actually makes it really clear how they've done it. So being much clearer about their criteria for allocation, and that the reason it's put in is the next allocation process they have is June, is when they can test out their new way of doing this. But I think it's about making sure that, you know, if you've got a conflict, say, of a number of people who want to use the same sort of dates, for example, that there's real clarity about why a decision was made about, you know, one person being able to access it and somebody else maybe was turned down. And I think it's that bit about making sure that the criteria for it are objective and transparent and really clear. So we'll see after the June process how well that's worked and whether or not they need maybe to do some further work on it.
Come back very briefly, Chair. Just in regards to, I noticed that the recommendations for noting only, and it's come back to at the appropriate time we get to recommendations. Just in regards to that type of feedback, how do we actually get that back?
Heather.
I mean, this is the first time we've brought a report of this nature where we've tried to pool together, sort of in terms of the regulated services, the recommendations. And this, I think it is worth thinking about whether or not we then bring it back more regularly, which would then allow you to see the progress of the recommendations. So I've done it this time in terms of the overall year, and I think it would be helpful probably to think about, do you want it back, you know, annually? Do you want it back every 6 months? And how we do that, because we should be doing that, and that would be really helpful, because I think that would allow you then to be able to come back and say, well, actually, you know, why is that not progressing in the way that we would suggest? And therefore, when the care inspector come to do their next inspection, you've got that reassurance about that level of progress.
I think that's actually a fair point, and I think 6 months is too long, I would suggest, and in between each committee doesn't give them enough time for anything to happen. So I'm going to suggest every second committee we would get an update on the thing. If members are happy with that, we can have that as a standing item, I would suggest, on this agenda. Last questions, I'm going to Willie, and then I'm going to move to recommendations. Willie, you know what, right, okay. In that case then, there's no one else wanting in. We've got the recommendations. Sorry, Roberta. Thank you. You pass it on to staff? Yes. Thank you. We'll move on to recommendations then. 2.1, are we happy to note the outcome of the activity? 2.2, and are we happy to note the progress being made in respect of recommendations? Okay, thank you very much. We'll now move on to item 5. Sorry, Ian.
Sorry, Chairman. I wonder, with 2.3 to say we'll get a bi-monthly update, or sorry, every 4 months, was it say every second? Would that be a recommendation or just an action?
Well, it doesn't need to be because we've made the commitment that you'll get it. But we'll put in the actions in the minutes. Yeah. Okay. Thank you. Looked after children. This report was requested by members in October last year and is in the main a statistical report giving members a breakdown area by area. Sarah, you're taking us through this. Is there anything you'd like to add, or can we go straight to questions? Okay, go straight to questions. Jock?
Hi, thanks, Chair. I think you blamed me for asking for this report, and thank you very much for providing it. It's a really good report, and it lets us see exactly what's being done for these youngsters who are in need of support and protection. There's one thing, could you clarify exactly in 3.3, you'd like to see a bigger reduction in children that are looked after at home. Could you just clarify exactly what you mean by that, please?
Yeah, well, really what we would like to see is more work done with early intervention, and that fits into GERFEC more on a voluntary basis where there's children's meetings and children's plans before it gets to statutory intervention, really. And then those that do need that, which should come from a child's meeting, a recommendation to a referral to the reporter, then that means that there's more time to focus on more intensive plans for those children, really. That's the reason. Okay.
Yeah, Chair, welcome the report, but I think we need to go further in the report, not only in terms of looked after children, but a number of children under the GERFEC. And Sean, I've been meeting with Sean and the Director of Education on the process of GERFEC. And given that it became the Act in April of 2014, I believe, and then there was a lead up to it, so GERFEC's been in for a considerable time. I think what we should be looking for is a more comprehensive and extensive report on how GERFEC is actually working in terms of the named person that is referred to in the document and in the narrative in the report, but also the professional role that social work plays in GERFEC and getting it right for every child, not only in education, but across the board. So I'd be looking for a more comprehensive report as to what the impact of GERFEC has been, how many meetings there have been of GERFEC, and Sean knows what I am talking about in that respect. When I turn to 3.4 and the question asked about the number of looked after children, and it refers here to in 3.4, 11 children are currently being assessed for permanence, and this includes asking extended family members to consider possible kinship arrangements. And I did ask a question of yourself, Chair, at the previous meeting and got the answer back. So grateful for your answer, Chair, but it's along the lines of 3.4 in terms of one of the crucial things is that early payment is made to kinship carers in the looked after, and I think it was confirmed that we do have, contrary to how others believe it not to be the case, but we do have kinship carers who have not received up to the date that you produced the information, Chair, and I presume things are still the same unless you tell me differently. So a number of things, Chair, in terms of not question, but I think we should be looking for a greater report, and I'm asking for that as early as possible, hopefully in the next meeting, in terms of the impact to Garfec, given what was described to me as very much in its infancy, just how it's operating and what effect it has on social work in terms of how they're using Garfec, and an assurance that kinship carers are being paid as tenuously as possible or as quickly as possible.
Willie, I think you're right, and we need a report back, because it'll be jointly to the education and us, because it's a joint process in terms of the council. So we'll bring that back when we get all the stats and everything else. So your point's well made. Jane, you were next, I think, yeah? Are you okay with that, yeah?
Thank you. I just want to sort of ask about the 3.6, the Scottish Reporters Administration. I mean, SCRA's requirements, did it actually lead to a demand for an assessment of what was happening in S4, or was it simply saying that we ought to be looking at plans for looked after children, education plans for looked after children? Because, I mean, the truth is that, you know, things progressing well might be speak for everything's just quiet. and I, you know, with the best will in the world, everybody's busy, but if you don't actually have specific targets for education at an earlier date, I mean, I think S4 is far too late. You know, the thing's done and dusted by that stage. In fact, half of them might be trying to leave. So I'm concerned about why S4 with respect to SCRA.
Well, yeah, you're right. The education, when we were, the report was about looked after children and their education, and we do. That's one of the things that we are trying to make sure the improvements are made in their plans. But we were just asked to look at the S4 children that was with it in our own, just to see how we were doing with those. But it wasn't to mean that then that would be exclusive and not considering education in all children's plans. And I think it was something that we did recognise, that we focused more on making sure that things were fine and they were attending school, and we needed to be more detailed about those that were doing well, how they reached their individual targets, those where we needed to look at other things to build up their plan. So it was, although we did the audit for S4 because it was kind of crucial for them, it does need to be in all children's plans, all looked after children's plans, more detail about their education.
Thank you for that assurance. So would we be able to expect, you know, when we're looking at, and thank you for breaking down the numbers in each of the areas, localities, because that's where we're beginning to start. I mean, eventually, I would expect to look at anonymised education plans for looked after children, and look at what's been placed in position for our children in loco parentis, in the stewardship, for argument's sake, to see then what's been happening, because that's the read across. You know, we ought to be able to see what the plans are and then what has been achieved.
I think that's something that we could do. We could look at bringing some examples of plans of children and what's put in place. And I think that the changes in the education system with the National 4s and National 5s are going to help looked after children, because it helps their, you know, depending what's going on for them at that time. And that's probably where our difficulty's been. We focused on trying to help children settle down, trying to help address their immediate concerns, but then to try and help them cope with education as well. And the changes in the system, I think, will help the flexibility for those who weren't able to take a National 5 exam because they'd missed work. They can then take that the next year. But we could certainly look at bringing some examples of plans.
Yeah, sure. It might be better if this type of work that Sarah has described will be done within a member seminar. And I'm saying member seminar because it's like social worker clear they have got the primary responsibility for looked after children. But we can't forget our educational colleagues have a bigger role to play here as well. Now, our educational colleagues will attend looked after reviews, and bring that educational plan there. But so sort of when I'm sitting here this morning, I'm really thinking this is a member seminar around looked after children, and including just what we spoke in the earlier report about our most vulnerable children in Carnran House. So just a proposal there from myself.
Thanks, Sean. Just for my own benefit, S4, every looked after child goes up to S4. So is that the transition period? Is that why you focus on that in the early?
Yeah, yes, it is. It's because everyone is still at school then and looking at what happens to them from whether they're going to be, I mean, that we have to consider, are they staying at school? If they're not, what are they going to be doing? But I mean, a lot of schools have got really good leavers programs now in place for young people and courses that they can do. So that helps us to build that in. But yeah, I think that's why that was particularly chosen, because also we report annually on the achievements of looked after children following S4.
Thanks, Sarah. Willie?
Yeah, Chair, and I think it is important, and S4 is perhaps an important year, you know, in terms of it's a measurement, and it's an important measurement, but there are many other things happening in a child's life under getting it right for every child, and it may fall, and indeed on numerous occasions, it falls out with education. So Sean's idea of a seminar to me is sound, in that we should be involved in education, health. Indeed, it was referred to as health coming to the table late in their training and then being a named person. So it just isn't only social work and education. Health is also a partner in getting it right for every child as a named person. So I think that we should perhaps be looking at a seminar to see where we are. We're getting it right for every child, because education is only one measurement, a very important measurement, but there are other things as well in that child's life and the family, the wider family, and we've got to get it right for them in terms of how we assess. So I think a seminar is important, but I come back to, you know, and I'll come under the recommendations as it says in 2.1, and I'll ask at this point, Chair, when I'm back in, is that I do ask for a report on looked after children and those with comparable needs, that we get a report to the next meeting, that we are up to speed, and an update in terms of where we are with payments to looked after children and those with comparable needs. I seek that report, Chair.
I can give you the confirmation the report will come, but I can't say it will be for the next committee meeting, but it may not be actually physically possible to do that, so I wouldn't like to commit to doing that. But yes, that can be brought back, and you can speak to Sean out with here. I'm not getting anyone else here just now, so I'm going to move to recommendations. Are you happy with 2.1 on if it's minuted that we're...
No, Chair, not just to note it, but to seek an early report on getting it right for every child, and going along with what Sean's saying in terms of a seminar, which I think is
that's what I said. Are you happy if we include it in the minute of the meeting that we're actually going to take that forward? Yeah, okay, thank you. So we agreed 2.1? Yeah,
as long as there's the reference to it, that we get an early report, Chair.
Yeah, absolutely. You've got that reassurance, yeah. 2.2, the quality assurance process, be happy to note. Thank you. 2.3, we note. Thank you. 2.4, happy to note. 2.5, happy to note. And 2.6, happy to note. Okay, thanks very much. Sarah, thank you very much. We now move on to item 6, appointments to outside bodies. I think your name's on this, Sean, isn't it? Yeah. Yeah. And I don't think we need any speeches about it. We know what the positions are. The 2.1, the alcohol and drug support, West of Scotland. My recommendation is that the Chair and Vice Chair actually attend that, because it's a strategic committee and it's a strategic coming together of partners. Are we agreed? Ian?
Maybe just put a slate down, Chair. We can agree that for the whole lot.
Well, okay then. Right. On 2.2 then, the two members of the Dumfries and Galloway Care Trust, the sitting member just now is Councillor Dick, and we're suggesting he continue, and the Vice Chair as second nomination. 2.3, the members of OPCG, that traditionally has been the Chair, and I'm happy to continue. And then 2.4, the appointment of one member of Volunteer Action, Dumfries and Galloway. I've got one declaration of interest, and that's Councillor McKee. I'm looking here, and I can't see any need for a vote. So, as the slate, are we happy to agree? Right. Thank you very much. Move on to item 7, the ADSW conference, 18th, 19th of June. Again, Sean, this is your report, and again, is there anything you'd like to say at this moment in time? No, it's quite straightforward. I'd just like to say, we normally send one, 2 seconds, Wally? Yeah, we normally send one, or in the past we've sent one. But the nature of business, and the nature of business this coming year is outlined, and you'll see some of the huge issues. The very nature, some of the seminars are operating side by side. And it's important that we have elected member representation at as wide away as we can. So that's why it's now doing for 2 members to go. Willie, you want it in?
Yeah, Chair, given that we've faced serious or severe cutbacks and continue to face that, is it essential? I know you've just referred that you'd like 2 to go because of the nature of the business, but is it really essential that we send anyone at all, and what's the value of sending them?
Well, all I can do is assure you that I learnt a lot in the last 2 that I've been to, because we're getting up-to-date information, progress reports from senior government officers that we wouldn't normally get. The briefings we're getting straight in, just like in 2 seconds, Ted. So I benefited from it. I've been kept up to speed. I'll let Ted in now.
Yeah, I'm acutely aware, of the sort of council finances, and I actually sought some advice from the interim Chief Social Work Officer on the value of this conference, and he gave me a very, very strong recommendation that it would be a conference that I should attend.
Ian?
I think the key thing is in paragraph 3.2, where it says that throughout the year we'll be preparing for the integration of health and social care and extending care services for young people, and doing so in the context of reducing budgets and the full impact of welfare reform. And to me that says it all. I think it's absolutely vital. The Vice Chair goes as well.
Thank you. Jane, you want it in?
Yes, I want to say quite clearly that I have no hesitation in saying that the Chairman and the Vice Chairman ought to go, and they ought to come back with a sheet of the principal things that they've learnt, and they ought to tell us what we should be looking for in the next year. So I have no hesitation about that, but I do expect a report back. I think probably, as all members quite rightly should expect to hear back from you about the issues that are raised there.
As you're aware, Mrs Maitland, every year I've reported back to this committee, and a full report for both from myself and either the Director of Social Work at the time or the Acting Chief Social Work Officer. As long as you give me a smiley face, I'll be quite happy to come back with my report card. Anyone else? Are we agreed? 2? Right, thank you. Item 8 is purely and simply the minutes of the Older People's Consultative Group for information only. I'm assuming that. Right? Sorry.
Sorry, Chair. No, just it was the 2. Did we agree the 2 people?
Yes, we did.
We did, aye.
Yeah.
But no, the number, the actual people themselves. I think it was.
All right. Sorry. It was the Chair and Vice Chair we'd said when we started. Yeah. Okay. So on the OPCG, just It's really just really for noting here and for information. If anybody's got anything they want to raise amongst it, they can speak to me personally, because I was the chair for that last year. Okay, I've got no other competent business. Willie?
Yeah, Chair, there was extensive communication last night on the issue of Dunmuir Park in Castle Douglas. I just wondered if you were going to take it, but you've just referred to you've no other business. Is that correct, or have you decided not to take it? I think the request was made of you to take it this morning, Chair.
Yes, I was included in the communication. My understanding that there's an ongoing dialogue between senior officers and the families in an attempt to resolve matters. In fact, I believe there's meeting plans for early next week. As such, this issue doesn't warrant to be taken as urgent business. Okay, so
but I will pursue that through standing orders and vote on that, Chair.
That's your right, Councillor. Thank you. Okay, thank you very much for your attendance.